Welcome to C3. I'm Parag Doshi from Chicago Cardiology Institute. To my right is Dr. Brian Kluck, cardiologist from Lehigh Valley Medical Center, and Dr. Nilesh Balar, vascular surgeon from Montefiore Medical Center. As you can see, we have a true multidisciplinary approach to C3 and bringing well-renowned experts on the arena. And first I'll ask Dr. Balar about what's new on the vascular side in C3.
Thank you, Parag. It's interesting. Every year we have been adding new programs. This year we have several sessions. One of them would be hands-on sessions where we would be evaluating and putting live hands-on courses, including some of the courses that would have venous duplex evaluation in venous disease and also arterial disease, where we would be able to do hands-on courses. The second important thing we are going to add to this year's program is coil embolization with different kinds of coils, where you would have a chance to evaluate the coils and do hands-on courses where you would have to pre-register for all these things, so you would have one-to-one mentoring as well as ability to deploy the coils and learn about the coils. Since it's an interesting field, recently a lot of people have expressed their interest. This is a good venue to get started on your new program. And to add to all those things, we also have the programs that we had before. Many of you have attended the courses, and it would be a good venue to be there and learn new things that we have added on.
Well, this is fascinating because you'd hear the lectures and techniques from well-renowned experts, and then you can go and then right away practice on the actual models, be it cadavers or plastic models. So this is great. On the coronary side, we are bringing some of the latest topics and controversies. We're going to talk about left main bifurcation. On the CTO side, which has always been very popular, we're bringing European CTO Club, Japan CTO Club on the same podium as North America, discussing latest in techniques, then also talking about the different stent platforms, left bifurcation stenting, and newer medical management treatment. So it should be really fascinating. Now, to top it all, we also have very strong venous disease platform at C3 for any experience or newer operator who wants to get started, and Dr. Brian Kluck can enlighten us on that area.
Thanks very much. I'd have to say that we have been at C3 talking about venous disease for almost as long as C3 has been in existence. But year after year, meeting after meeting, it comes back that people really want more. Venous disease has exploded as a technology in the vascular area. It's exploded as a treatment modality that's utilized by vascular surgeons, by radiologists, and by cardiovascular specialists and endovascular specialists in an increasing number. We've responded to requests to become a little bit more thorough in our venous treatment discussions to include some of the newer non-tumescent, non-thermal approaches to endovenous ablation, to expand into the more complicated areas of obstructive venous disease, as well as do some of the more basic things. One of the more interesting situations that I've had is I had a prior cardiovascular fellow who came with me to C3 to get interested in venous disease, and subsequently, when it came time for him to look for a job in the cardiovascular world, invariably his potential employers asked him if he was trained in venous techniques, and when he said yes, it solidified his employment. And this particular individual went on to start a venous program at one of the local Pennsylvania places. So C3 can not only tackle the very complicated things, but it was the nidus for him to not only learn venous insufficiency treatment, but also find employment.
To add to that thing, in today's discussion, we also have a very brand new topic, which would be pelvic venous congestion, which has been a new modality and a very current topic with the childbearing patient population between the age of 25 to 45. 30% of patients do have some form of pelvic venous congestion, and that is a new topic that is added 2-hour sessions this year. So we would love to see you guys at C3 this year, and you'd be happy to learn about all these new topics.
Great.
Thank
you
you.
so much. And also, we also very strong, a great vessel aortic intervention the coverage. We also have very good coverage in structural heart disease. And really, all these topics are presented by some of the best faculty in the world. So, see you all at C3. Thank you.
Thank you.